Abuse No More, The Voices of Refugee and Asylum-Seeking Women is a user-led research project which is aimed at increasing gender sensitivity and asylum process. 12 refugee and asylum-seeking women were trained as community researchers to interview 46 refugee and asylum-seeking women who live in London.
What is unique about our project is the fact that it is user-led. So the key research findings identified by the women themselves are used as the basis for a training program for practitioners who work with this particularly vulnerable group. Our research has highlighted that refugee and asylum-seeking women experience particular problems with health and legal service provision. And given their immigration status, these are the services which make the biggest difference to their asylum claim itself. So they are particularly crucial when it comes to the whole experience of living in the UK. The key research findings of the project include the importance of building trustful relationships between refugee and asylum-seeking women and practitioners, the importance of time in those appointments, especially when it comes to health and legal service providers. Also the importance of gender. Some women do not feel comfortable with male practitioners due to sensitive nature of their experiences. And last but not least, the importance of human rights principles such as fairness, dignity, and equality. The main issue that refugee and asylum-seeking women face when it comes to accessing health services is the issue of access itself. Quite often there are problems with registering at the GP practice. The people at the reception and sometimes the GPs themselves don't understand that women are actually entitled to healthcare in the first place, and they ask them for documents which they simply do not possess.
I would like to register, please.
Okay. Do you have passport?
I'm an asylum-seeker in this country. I don't have a passport yet.
So that's the problem, you don't have passport. So you can register.
I still have to travel all the way to my GP because my local GP couldn't register me to, because they're asking for a proof of bill, a passport, and a benefit letter, which I don't have.
And after some time, I was still seeing the GP because of my complications. My real GP wanted to put me on, but I don't know if it is from the surgery. They just called me one day, oh, you are not entitled to NHS service anymore, and we are striking you off the list and everything. They just struck me off like that when I was seriously ill and I needed medications and a lot of things. So it was so devastating to me because I had to stay for a year plus with no GP and my case went worse. So by the time I could get another GP, which I did this year, my kidneys, my liver, everything has dropped so bad. So most of the time, the GPs, once they know that you have maybe any paper problem here, the way you are treated is quite different. The way even the receptionists talk to you when they call you, and most of the time now, as the system is, they put all the things about you in the system. So anybody that goes and you call, your name comes up, they see everything about you, and it's quite embarrassing. That one is something that should be looked into because asylum seekers and refugees are not really treated as, at times you're being treated as if you're not human. You are less human than any other person.
Another problem that refugee and asylum-seeking women have described is consistency of GP care. The fact that they often have to change their address, and every time they change their address they move to another GP, and they have to recount often very traumatic stories once again, and they find it extremely difficult. And they also feel they are not able to build trustful relationship with a new GP all over again.
You have to be able to trust your GP. So for that, it doesn't mean that it has to be many of them, to see many of them or changing them all the time. So you have to have like a GP that can see you almost every time that you have an appointment. So yeah.
For quite a few women, even those who have been in the UK for quite a few years, it is still difficult to express their health problems in English, and there seems to be no provision of professional interpreting services available at certain GP practices. And some of the women are, for example, asked to come along with their friends or even their children to GP practices, which is not appropriate, because then the issue of disclosure of sometimes very private and difficult health-related problems becomes very challenging for those women then.
How can I help you today?
Yes, I have a patient who's French speaking, so I will interpret. Donc, qu'est-ce qui se passe? Quel est votre problème?
Yeah, le problème avec moi, c'est que depuis que je suis ici,
The first time I went to the GP to see my GP to talk about my gynecological problem, because I wasn't speaking the language properly, he's gonna advise an interpreter. I had that interpreter over the phone, and everything that I was saying is not translating exactly, and the doctor was saying that, oh, so I had a fibrosis. After that, the interpreter finished saying whatever he wanted to say to the doctor, and I said, no, the interpreter didn't translate exactly. I'm not suffering for anything else. I think it's a fibrosis, but it's not like the thing they think is cancer or something that I need to go to do a scan or biopsy. So I was really, really shocked.
What brings you to the surgery today?
I have a problem with my ears. There's a throbbing and I can't seem to work out what it is.
A throbbing, yes?
Yes.
Is it just in one ear?
Yes, just on the right hand side.
Right. So I need to have a look at it. So you're going to need to remove your head covering.
I'm not quite comfortable with that. Is there a female doctor that I can have instead?
regarding the gender, I'll just go for, and I think it's a little bit hard when you is an opposite gender, like a GP who's an opposite gender to you. It can come across a bit intimidating and also like embarrassing sometimes to explain everything.
And also, from what I understood, she is experiencing some health problems as a female, as a woman.
So can she be more specific what those problems may be?
Quels problèmes vous avez avec des choses?
Le problème c'est que quand j'étais à mon pays là-bas, j'ai été violée. Oui, j'ai été violée. Depuis là, ça m'a rendu un peu... c'était un peu difficile pour moi, vraiment. C'est une chose que je ne peux pas jamais...
Well, the problem is that she was raped back home. You know, it happens in Congo all the time.
Example, if you're a victim of abuse or raped, things like that, but you don't really want to say those kind of things to a male GP, you know.